Dr. Sonja Fuqua, the Director of Clinical Quality from the Community Health Center Association of Mississippi, and we would like to welcome you to the second in our series of Combating Pandemic Pounds and Coronavirus Carbs webinars. As you may recall, just a little bit of information, background information. This is an extension of our 65 by 65 Obesity Prevention Challenge initiative. We recognize obesity as an epidemic in Mississippi that contributes to the chronic health conditions resulting in decreased lifestyle mobility and increased healthcare costs. Community Health Center Association is taking a long-term approach to reducing that. We know right now that Mississippi has the highest adult obesity rate in the nation at 40.8%. And 40% of our children are overweight or obese. So what we have done is we are looking at some of the greatest barriers to staying healthy and maintaining a healthy lifestyle. Those barriers have been exacerbated with the many lifestyle changes in response to the COVID-19 pandemic. We've had lockdowns, shutdowns, business closures. That includes our gyms. Our diets have changed, and not to mention the decrease in our physical activity. So we decided to do this series of 30-minute webinars. We don't mean for them to be burdensome. As a matter of fact, I call it a mental hygiene break. Again, today we will have our second in the series, which is going to be on nutrition. And our presenter is Kyskie Bolton. She's a registered dietitian, certified provider at G.A. Carmichael Family Health Center. She is also the program lead for our childhood obesity management program at GA. You may have heard it called MEN. At this time, I'm going to allow Kyskie to give us the presentation on nutrition. And at the end, we will have question and answers if you do have those questions. So make a note. All right, Ms. Bolton, I turn it over to you. And thank you so much for consenting to do our presentation today.
Thank you so much, Dr. Fuqua, for inviting me. I appreciate it. My name is Kyskie Bolton. I'm a registered dietitian. I hold certifications in weight management for pediatrics as well as adults. See mostly pediatric patients, some adults, and we'll be speaking on today's topic, which is combating pandemic pounds and coronavirus carbs. It's just kind of like a funny little pun. In the spirit of being in the pandemic, I am at home and there are children here. I have made every treat and threat available to them for them to stay quiet, but if they don't, please forgive me. If you hear a dog barking, we have a new puppy as well, so please forgive me, but I think we'll have a quiet time. So today what we're going to be speaking on is weight. It's kind of like, for most adults that I know, you know, the little man over in the corner that you wish would go away. It's just there all the time. There's nothing that we can really do about it except face it head on. So we're going to go ahead and get started. I'm going to speak for about 20 to 25 minutes. If you have any questions, I would tell you to put it over in the comment section. I am not the best Zoom coordinator, so to say, but I will do my best to answer those questions with the help of Dr. Fuqua and the IT staff. And then we'll open up and unmute for questions at about the 25-minute mark. Okay, so in this presentation, we're going to discuss the pandemic's impact on health, pinpoint environmental factors and nutritional factors that contribute to weight gain or health decline. I'm going to highlight current popular nutrition fads and review basic nutritional and exercise needs. And we're going to strategize ways to reach our goals. So an important note is that maintaining self-care and creating a healthy lifestyle for yourself is the foundation of maintaining good health. We all heard you are what you eat. But that's true, you know. We don't think about it as adults sometimes, but a prime example of that is infancy. In an infant and in small children and toddlers, parents are generally, oh, I'm so sorry. There's some noise going on. It sounds like some construction. Forgive us. Let me see if I can figure out where that noise is coming from. Okay, so with self-care, and when it comes to children, we always focus on what our children are eating, what our infants are getting, whether that be breast milk or whether that be formula. We want to make sure it's the best thing that they can get. So the same thing applies to us. We're continually turning over brand new cells, and we want those cells to be the best and most healthiest possible. So in this pandemic, and this is definitely if you guys want to go ahead and put some notes or some questions or comments in the comment section, where we have just been inundated with a whole new way of life. With the quarantine, there's been a positive and a negative effect. We may have been more at home, but some people have not gone out or had not been going out to get food. So they had a limited supply of food, and they may have been eating and drinking kind of like whatever, or ordering out or ordering food. Simultaneously, if they've been eating less, you'll also notice that they may on the opposite end be eating more and having excess food. Gyms have been closed and reopened, but some people are afraid to return or wary of returning. In some cities and localities, the parks were closed, or especially the portions of the park where children may populate or people may populate around play areas. If we've been faced with basic illnesses, the regular common cold or other illnesses, on top of coronavirus, that has changes in appetites. And in people who have had coronavirus, they've reported changes in their appetite. Anecdotally, just people that I know who've had it have lost their appetite, simultaneously gaining weight. Or the opposite, lost weight while they were sick, and then had a rebound and gained more weight once they the illness left. So we are faced with the basic illnesses that have not stopped: sinuses, colds, the regular flu, on top of coronavirus. And doctors are still learning how that changes our bodies, if at all. And some, myself included, we're working more, covering more, filling in for people who may be out. If you have people who are either working from home or who have children at home, they may not be on site at some places, so we may be doing more work there. Or the exact opposite, some people are out of work, some people are working less. They may be working from home, which may have a less of a workload, physical workload. Both of those things can cause weight gain. In working more, you don't allocate out time for food prep, and you may be eating out more, or you may be eating very quick things to prepare that may be more fattening. Or if you're working less, you have more time devoted to eating, and you're less active, which can cause weight gain. With schedule changes, whether that be work or personal schedules or children's schedules, that can cause people to get off of their routine. And in getting off their routine, weight gain, low activity can result. One of the hallmarks of the pandemic, in many, definitely my mother included, myself being an only child, is isolation. There's the fear of the coronavirus coupled with the mandated, I just had a brain spot, but the mandated social distancing. So with social distancing comes isolation. With isolation can come depression, decreased appetite, or increased appetite. Simultaneously, though, quite a few people are having issues with isolation. Myself, being an example, I'm having overexposure to people. I'm with my children like all the time. There is no break. There is no grandparents to drop off. There is no going over for an afternoon with a person or something like that. There's not even any play dates or anything like that. So our family have been overexposed to each other. And one of the few things that we, as a family, especially with teenage children and small children, can agree on is food and movies or things like that. So some people may be tired of people, tired of significant others, tired of being exposed to so many people in small enclosed spaces, while others may be craving companionship. Each one of those things can lead to excess weight gain, low activity, and poor mental status. So in a note of self-reflection, when we're getting ready to start making changes in our life, we have to self-reflect and look at ourselves to see what is it that's causing this. So how has the pandemic changed your life? It's changed everyone's life, some in exact opposite ways. More work, more food, less food, isolation, overexposure. Pinpoint what those are for yourself. Once you've decided what those problems are, you can figure out what factors have caused weight gain in you. Is it that you're eating too much, eating not enough? Are you exercising at all? Are you eating out a lot? Are you eating at home? Do you know how to cook? Do you not know how to cook? So all those things can cause, and we have to know what those are in order to make changes. So once we've had that self-reflection and people get ready to have a change in their nutritional life, it's important not to fall into fads and trends. Now, I've listed a very, very, very small amount of the nutrition trends that are out there. If you have identified some new things that you've seen or heard about, please put them in the comment sections. I am a dietitian, but it's really hard to keep up with all the new stuff that's out there. Now, I have this list here, and none of these that are listed are necessarily bad or necessarily good. Each one of these diets, if followed, will probably result in weight loss. Dieting is not the issue when it comes to people losing weight. Consistency is generally the problem when it comes to weight loss, as well as understanding how diets work and how each our bodies work. When it comes to that, a lot of new or fairly new, now it's kind of been more of the routine, companies have popped up, locally owned companies. Maybe I'll just use called Canton Square Tea or Canton Square Nutrition or Byram Nutrition or something like that. Those are places that sell teas, juices of all sorts of flavors, smoothies that are meal replacements. They can also be quite expensive, in my personal opinion. You know, of one beverage for $6, $7, $8, $9, $10. A lot of people that I've come in contact with who frequent those places generally will buy something for breakfast and for lunch, and in an effort to lose weight. Again, it will work in some people if they stick to it. It can be quite expensive over time, and it can be something that's hard to maintain. One of the biggest misconceptions is what they're drinking is healthy, or what they're drinking is a full meal replacement, or what they're drinking is like what's inside is the magic of making them lose weight. There's always space in a diet to have a meal replacement beverage, but if you're drinking meal replacement beverages without understanding what's in them or understanding how many calories they are, and simultaneously assuming because you've had that for breakfast and or lunch, you can kind of eat whatever you want later, it may result in some disappointment, especially in maintaining a weight loss for a long time. Intermittent fasting is something that has been around for a while. It's much more popular now. It does work in some people, but intermittent fasting is something that you have to be meticulously religious about. It also doesn't work in people who have certain medical conditions or people who just don't have that willpower. It takes a while for the body to recalculate its metabolism and recalculate its cycle of needing to eat. It doesn't work well in some people who have really, really busy schedules that are always moving around a lot. Simultaneously, it doesn't work in people who are just sitting down a lot. So intermittent fasting is definitely something I would suggest that someone try under the direction of a dietitian or a medical provider. And it's definitely not something that you should just try out, because it can result in people passing out, diabetics having medical emergencies and things like that. So it's really not something that I would recommend trying without a lot of planning and preparation. I've heard recently of blood type diets and body type diets. In those diets, based on whatever your blood and or body type are, you eliminate certain foods. So just example, type B blood, or AB, positive, negative. You go through this list, and because you have that type of blood, you don't eat these foods at all. So I always warn against any diet where it eliminates total or certain food groups, because that's generally not a good practice. Same thing for the body type diet. Each person's body composition is a genetic coupled with environment. And just because you eliminate a certain type of food doesn't mean it's going to actually change the way your body's shaped. I've seen diets based on age. All of those are very similar. No real information on whether those things result well, and it definitely would not if it's eliminating certain food groups or certain full categories of types of foods. Now, vegetarianism and veganism is definitely not new. It's something that's been around, since the dawn of time, but it's been a new trend that I've seen in people because there's been a lot more what they call content creators on Facebook, YouTube, stuff like that, where people are showing the diets that they eat. And when they do that, it people tend to just jump onto their boat or jump on there, and they assume because you are now eliminating meat from their diet or eliminating all products that may be animal-based products, that's going to just kind of like magically make you lose weight. Well, because there's so many products on the shelf now that are vegan products or vegetarian products, people who go vegan or become vegetarians tend to buy those products. And what they're doing is buying processed foods, but not looking at calories. And calories counts in all of these. And everything that's listed here on the screen, it doesn't matter how many of these things you follow. If you're eating too many calories, you're going to have poor results when it comes to weight loss. So I'm not discouraging anyone from following any of these diets, but if you do, you can notice that they may not be working for you if you're not really careful about following the diet to the letter, and also making sure that it's well balanced and doesn't have too many calories. So what is a healthy diet then? I'm not going to discuss what you specifically should eat, what you specifically, Dr. Fuqua, should eat, or what the other participants on here should eat, because every person is different and has different desires and wants and likes and dislikes. But what every single person's diet should consist of, unless you have a specific medical conditions or taking certain types of medications or have instructions from a provider on what to do or not to do, maybe like a person who may be on dialysis and have to restrict their water intake, or a person who may be taking certain type of medications that may have to restrict fiber or restrict certain types of vegetables. Most people should do what's listed here on the screen. In women, you should have a minimum of 6 cups of water a day. The taller you are, the more cups of water you need. If you're a man and you have more muscle mass, you should drink at least 8 cups. I recommend to most people, start at 8 and see if you can go up from there. You should eat something from each food group daily. That includes the meat, which meat really means protein group. So even if a person is a vegan or a vegetarian, they should eat some sort of source of protein every day to make sure that their body's keeping up with their protein needs. Should also know what regular serving sizes are. Some of the problems that people have is not that they're not necessarily greedy or they're necessarily just hungry so much, is that the serving sizes that are presented to the American population are usually 1/2 to double or triple the size that's recommended. So we get used to eating large portions, and when we convert back to regular size portions, it's very difficult to eat that amount and not feel fulfilled. So when we're eating proper portion sizes, that does not mean that we're going to be hungry. It means that we're going to avoid low nutrient foods. So what are low nutrient foods? Low nutrient foods are foods that give you a whole lot of calories for a very small amount of food. A good example of a low nutrient food would be one of those kitty size or snack size chips. So the little bag of Doritos, the little 1 ounce bag of Cheetos or something like that. If you were to take that bag of chips and crush it up into tiny little pieces, it would probably only take up 1/10 of the space in that bag, but it still has about 200 or so calories, 250 so calories. So in that 250 calories, you've only eaten enough food to fill the palm of your hand. It's a snack, but you're probably going to be hungry immediately after and need something else to eat. Another example would be apple juice versus an apple. So 100% apple juice does contain most of the vitamins and minerals that may be in the apple, but it's concentrated in sugar and it doesn't actually fill you up because you're not getting the amount of fiber that you would be getting from an apple. So when we avoid low nutrient foods, what we're actually doing is allowing ourselves to be full of more food, but less calories. One medium apple is about 60, 80, 100 calories versus 8 ounces of apple juice may be the same. One of those things are going to keep you much full longer, give you more nutrition and more fiber. So while we're eating low nutrient foods, we're also getting more fiber. Unless you have a medical condition, you should eat about 25 to 35 grams of fiber a day. Fiber content is on the back of most food labels. If you're eating a fresh fruit or vegetable, you can pretty much guarantee that unless it's like a grape or something really watery, it has a good amount of fiber in it. When we do that, we also are probably going to eat about 5 servings of fruits and vegetables a day. And if that number, 5 to 7 servings, is kind of alarming to you, it sounds like a lot. But going back to that same apple, a medium apple is 2 servings. So if you ate an apple in the morning, had a cup of some sort of vegetable at lunch, you already are down to have eaten 4 servings. So it's not hard to get those servings in. It just goes back to the other slide of knowing what a serving size is. Unless you are intermittently fasting, which is a routine in and of itself, you should be having your meals on a routine basis about the same time every day. Our bodies kind of run real well on the clock. If you're on a schedule and you're eating the same time, the same amount every day, your metabolism is really going to be in love with that. It likes to kind of know. The crux is you didn't get a chance to eat breakfast, so you ate something flip for a snack and then ate lunch. Well, then you were running late, you didn't get supper done, and you ate late, and then you ate another thing. And so your body's not on a good clock. Having your meals routinely can definitely help you with your appetite and then with serving sizes. Avoiding excess alcohol is super key, especially during the pandemic. Patients that I've been seeing in clinic have gained a lot of weight. And when I've looked at their lab work, a lot of times their liver profile is elevated. Their body's trying to process all that alcohol. One thing I tell my patients when they're consuming alcohol is every time you take a shot, it's kind of like drinking fat because alcohol is 7 calories a gram and fat is 9 calories a gram. So when we're drinking alcohol, even if you're drinking mixed drinks and having other things in it, you're essentially just drinking. You wouldn't take canola oil and chug it back. And so I would recommend that you stay within the recommended amounts of alcohol per day, which is 1 for women and 2 for men. Okay, so we have only about 5 minutes left. So I'm going to shoot through this physical activity, which is about 150 minutes of physical activity a week. Again, sounds like a lot, but that's about 30 minutes 5 times a week. We should always have moderate intensity exercise, which means that we're getting our heart rate up, but it's not too excessive. Excessive exercise to the body is stress. So we don't want to stress our bodies. So whenever you're in the mode of exercise, you should be sure that you could talk to someone if they walked up to you, but you shouldn't be able to just carry on your exercise while singing a song, because if you have enough lung capacity to sing, you're not at that moderate intensity level. For women and men, you should never skimp on weights or resistance training. Weight training builds muscle mass. Muscle mass builds your metabolism, and that allows you to burn more calories while you're doing essentially nothing. You definitely do not need a gym to do any of those activities, but it may be good to consult someone, including your doctor, if you're going to start on a full exercise regimen. So remember that if you fail to plan, you're planning to fail. We must know what changes we have to make, what we need to do less of, and what we need to do more of. We have to plan at the start. So that can be eating up all the healthy foods and your unhealthy foods, or give them away, or something like that. Making sure that we cleanse our home and surroundings of those things. Shopping for the items we need, and that's definitely something that to take in consideration in the pandemic, because I've noticed that there are a lot of items that are not on the shelf, or I don't want to go in the store to get them anyway. So that may be planning on a pickup order or a delivery order, which takes more time, and some slots may be taken up. So definitely is something you have to plan well ahead of. If you're new to prepping food or cooking foods in certain ways, you might need to plan time for learning about that, watching videos or preparation information, and then planning extra time to have those things prepared. But never take away all your pleasures or all your treats, because that can result in you kind of backsliding and going all the way back, quitting or something like that. So always keep small servings of things that you like available so that you can feel, better. Mental health is the crux of all of this. It doesn't matter how much you're planning. If you're not in a good state of mental health, it will be very difficult to do. I'm not sure if Dr. Fuqua has some mental health experts lined up, but I'm sure she does. And then each of the community health centers that I'm aware of has mental health care professionals that can help us all during this pandemic if we need it. So one thing that I heard a long time ago when I was probably in my early 20s was, think back to when you first got your first car. Whether you were 15 or 30, however old you are when you first got your first car. If someone told you that car, that vehicle, truck, van, SUV was the only car you would ever drive from that day until you stop driving, pass away, how would you treat that car? Would you drive it fast? Would you run over speed bumps? Would you drive through the mud puddles? Would you skip on your oil changes? Would you park it close to other cars so they could get dented? Or would you drive it, 15 miles per hour for the rest of your life? I don't know if you would do that, but I know if I knew I only was going to have one car, I would treat that thing like, like it was a rarity. So our bodies are the exact same, though. We have to treat our bodies as if it's the only thing we're going to get, because it is. Keep that in mind when you're making plans, because it can be hard to see the end goal, but this is the best we got and we really have to take care of it. So my time is up. If anyone has any questions, Dr. Fuqua can unmute everyone and you can ask questions if you have.
All right, Ms. Bolton, thank you.
Okay, I do see the chat though.
Yeah, I do see a question in the chat, and I will bring that to our attention, but thank you so much for the presentation. This was excellent. We do have one question. We had several different things going on in the chat. People were putting information in there to respond to your self-reflection comment. Okay. But we do have a question. Do you have any information about Noom, very briefly? In addition to good nutrition, what is Noom all about? Are you aware? Very briefly. Okay.
Noom is a company, I want to say it started by dietitians. I'm not quite sure. I'm kind of cheap, so I haven't paid to find out, but I've done a little research. It focuses on the mental aspect of nutrition, which actually is the key to everything. And in addition to nutrition education, it kind of gives you examples of what I just did. So it will show a person a picture of an apple, and it'll show a person a picture of the apple juice, give them information so they can make informed decisions. So it also asks them about how they're feeling. Things like, are you hungry? Okay, I could eat, but am I hungry? Am I feeling hunger rumbling in my stomach? When was the last time you ate? Are you hungry or are you bored? How do you feel? So Noom kind of brings in the aspect of nutrition, education, and mental health all in one. It probably does work. It just depends on the cost. Again, going back to your body being a vehicle, if the cost is sufficient for you, I would definitely encourage anyone to start and try it. I think that the claims of it working is good. I don't know how they have it structured as to keep you. So any company, no matter how well they provide you with the service, they want to keep you in that service. So I don't know how you get in Noom, lose the weight, and get out of it, but the philosophy is legitimate and is worth a try.
Thank you for that. While you are thinking, if you have another question, and we have drawn nigh to our time, I do want to let you know that our next webinar is February the 5th. We're trying to do these first Fridays until we get to National Health Center Week. And the topic will be on, I'm calling it the skinny on exercise. Now, Ms. Bolton did give us one slide on exercise, but next time the entire conversation will be on exercise. So does anybody else have a question or a closing comment? And we do want to remind you that we are putting these webinars on our YouTube page. You can use them for review, to share with other people in your organizations who were not able to join us, or you can provide them to your patients and use this as documentation for providing nutrition counseling. Any other questions before we close?
Just to address Patricia and Edward, meal prep is definitely something you should try, Patricia. You just need to iron out time to do it, to prepare the meats and vegetables and prep it. It will make a difference. Do try to have a good variety because it can get kind of boring. So same thing with Michael, if you have time to meal prep, it would probably help as well. I'm the preaching to the choir, but it definitely would help. Thank y'all.